Hello everyone. In this video we will talk another very important topic which we encountered so many times in emergency department and ICU departments of any hospital. And this is the cardiogenic shock. It's an acute emergency and it needs a better understanding of the problem and its management. So let's talk about the cardiogenic shock. So first of all I would request those doctors and students who haven't yet subscribed the channel, please subscribe the channel and press the bell icon and also like and share the videos. So friends, talking about the cardiogenic shock, let's first of all break this terminology into the words. So it's a combination of three words: cardiogenic shock. Cardio literally or by word means heart, and genes comes from the word genesis or the origin. So this is something which is originating from the heart. And the shock is a very particular terminology which we define as a state of insufficient blood flow to the tissues of the body as a result of the problems with the circulating system or the circulatory system. So that circulatory system, it comprises of the heart, which has got four chambers: right atrium, right ventricle, left atrium and the left ventricle, and arteries. For example, the most important one and the major one is the aorta, which has got its origin from the left ventricle. Left ventricle pumps the blood, and through aorta it goes to the rest of the body through the arterial system, and from the rest of the body the blood comes back through the veins and drains into the right atrium, goes to the right ventricle, and from the right ventricle through the pulmonary artery it goes towards the lungs. So this is the only artery in the body, pulmonary artery, which carries the deoxygenated blood, and from the lungs the oxygenated blood is carried back to the left atrium through the pulmonary vein. So a state of the insufficient blood flow to the tissues of the body as a result of the problems with the circulatory system is known as the shock, and when the origin is from the heart problem, we call it the cardiogenic shock. Let's talk briefly about the shock itself and its type. Shock is characterized by hypotension, wherein we see a systolic blood pressure which is less than 90 millimeter of the mercury, and there is inadequate organ perfusion. We know from our previous knowledge and previous discussions that there are vital organs in the body, and five vital organs which are there in the body. These are the brain, heart, lungs, kidney and liver. So there will be inadequate organ perfusion, wherein you see the altered mental status when the perfusion of the brain is impaired, and there will be decreased urine output whenever there is a decreased perfusion of the kidney, and in case of the liver hypoperfusion, we will see ischemic liver where there is increase in the transaminases. So these are two very specific characteristics of the shock patient. Now there are four types of the shock, and these four types are the cardiogenic shock, hypovolemic shock, distributive shock and the septic shock. So let's talk briefly about the cardiogenic shock characteristics. A cardiogenic shock, it's a primarily myocardial dysfunction. For example, a patient has got MI, a myocardial infarction, and majority of the cases it will be the ST elevation MI, or even the non-ST elevation MI sometimes causes this type of a shock which we call the cardiogenic shock, and there are certain valvular problems. So all in all, what happens that the pump of the heart fails. So there is always a primary myocardial dysfunction, and it decreases the cardiac output. Now cardiac output is equal to stroke volume into the heart rate. Stroke volume is the volume of the blood which is thrown out of the heart with every single beat. Now this cardiogenic shock, it has got certain very specific clinical features, like there will be coldness of the feet and the hand. So the extremities are cold, they are unpleasantly damp, or they are clammy. There will be poor capillary refill when you put a pressure on your fingertips and you release it, it will take more time to refill as compared to a normal person. There will be an increased heart rate because in order to compensate for the decreased stroke volume as a result of the failure of the pump. So because body is to maintain, our heart is to maintain the cardiac output, so heart rate may go high, which causes the tachycardia. There will be a narrow pulse pressure. Pulse pressure is the difference between the systolic blood pressure and the diastolic blood pressure. For example, the normal systolic blood pressure is 120 and the normal diastolic blood pressure is 80. In these cases, there will be a narrowing of the pulse pressure where we will see that if systolic is 100 and diastolic is 80, so the pulse pressure will be 20 rather than the 40 millimeter of the mercury, which is normal. And this feature differentiates it from the septic shock, where we see a high pulse pressure, where there will be a higher systolic and there will be a lower diastolic blood pressure, especially the lower diastolic blood pressure, which increases the difference between the two. Because of the decreased perfusion of the kidneys, there will be low or decreased urine output. Normally it should be more than 0.5 ml per kg per hour, but in case of the cardiogenic shock, it will be less than 0.5 ml per kg per hour, or roughly 35 ml per hour. Urine will be less than this. The second type of the shock which we are to talk about is the hypovolemic shock. Hypo mean low, volumic mean the volume of the blood or the fluid within the vessels. So there is a decreased effective intravascular volume. Why we call it effective? Because it needs to stay inside the blood vessels. Sometimes because of the hypoalbuminemia, a lot of fluid comes out of the blood vessels and there is a third spacing of the fluid. So it also causes the hypovolemia in itself. But in majority of the cases, there are hemorrhages like the upper and lower GI hemorrhages, which causes the massive blood loss, and it is a reason of the hypovolemic shock. There may be too much vomiting and the diarrhea, like in cases of the cholera, then it will also cause the hypovolemic shock, because a lot of fluid will be lost and there will be decreased intravascular volume, which is obviously the extracellular fluid. And there can be any road traffic accident. As a result of that, there will be a major trauma and someone can bleed and can even bleed to death if that type of the shock is not reversed within a specific period of the time. Sometimes these patients have got a major surgery and there is a perioperative, or during the surgery they bleed, and if the bleeding is not stopped, for example, in some cases there is a hepatic there is a perioperative hepatic artery breach, or there is a trauma to the major artery which causes the hypovolemic shock. And sometimes burns which are more than like 33%, they also cause the shock because of a loss of a lot of the fluids from the body. Now the third type of the shock of the four types is the obstructive shock. This is again a very important type of the shock, because it happens sometime in the emergency department and they are shifted to the critical care units. These are the type of the shock wherein we see a kind of a pressure either from outside of the circulatory system or within the or inside of the circulatory system. So there is intrinsic or extrinsic pressure on the circulatory system which hampers the flow of the blood across the system. For example, we have got two very famous examples. One is the pulmonary embolism, where we see that there is an embolus in a massive embolus in the pulmonary artery. Now we have seen that pulmonary artery is carrying the deoxygenated blood from the right ventricle towards the lungs for the oxygenation process. Now here you see a large embolus which is actually occluding the flow of the blood across this pulmonary artery, and it causes a kind of a shock which we call the obstructive shock. And the second example, where we see that the pressure is not coming from inside of the circulatory system but from outside of the circulatory system. For example, a very famous example will be the pericardiac tamponade, where we see that there is a blood in the covering of the heart, which we call the pericardium. Peri mean around, cardium mean heart, and there is a blood over there, and it is causing the tamponade effect on the heart. It's making the heart to fail very easily, so that will also result in the shock or the hypoperfusion of the vital organs of the body, whether it's resultant effects, which are obviously the bad one. So this is an example of the extrinsic pressure put on the circulatory system from outside of the circulatory system. So this is known as the obstructive type of the shock. The last type of the shock is known as the distributive shock. Now, if we look at the circulatory system of the body, it comprises of the heart, which is the pump of the body, and then there are arteries or veins, which are known as the distributive system. Whenever there is a problem with them, for example, if there is an arteriovenous shunting or there is decreased systemic vascular resistance by the increased venous capacitance, then this is also known as the septic shock or the distributive shock, because there is a problem with the distributive system of the body. For example, in cases of the septic shock, we see that there is a gram-negative infection in majority of the cases. There is endotoxemia by the release of gram-negative endotoxin, and it causes the dilatation of the cells of the veins and the arteries. So venous capacitance will increase. A lot of blood will be accommodated within the venous system of the body, but there will be exudation of the fluid from inside of the vessels to the outside. So there will be arteriovenous shunting, there will be decreased systemic vascular resistance because of the dilatation of the blood vessels, and there will be increased in the venous capacitance. This is known as the distributive shock or the septic shock, because it's the second name of the distributive shock, and in it primarily the distribution system of the circulation is affected by anything. So it has got certain very important features. For example, because there is a vasodilatation inside the body, so there will be warm extremities, because a lot of blood will be flowing towards the extremities. That is why we call it the warm shock as opposed to the cold shock, which is the cardiogenic shock. Then there will be a very low diastolic blood pressure, and systolic and diastolic blood pressure difference, which we call the pulse pressure, will be on the higher side, as opposed to the cardiogenic shock, where we see the low pulse pressure. Systolic blood pressure is always less than 90 millimeter of the mercury. That is why we call it the shock. And keep one thing in mind, because in distributive shock or the septic shock, there is, in majority of the cases, in the beginning there is no problem with the heart, so the cardiac output remains normal. Normal cardiac index is more than 2.2 liter per minute per square meter. So cardiac output, which is a combination of the stroke volume and the heart rate, stays normal. In these patients, there will be increased capillary refill because of the same reason, because there is a vasodilatation. So a lot of blood will be flowing towards the extremities, and whenever we try to put pressure on the fingertips, then it refills very promptly. So the capillary refill is there and is on the higher side. So 4 types of the shock are the distributive shock, or the obstructive shock, and there will be cardiogenic shock and the hypovolemic shock. So this is a brief description about the shock, and in detail we can talk about the cardiogenic shock.